Northern California's first county-run center to handle calls from the new National Mental Health Hotline 988 is now up and running. Today, Santa Clara County unveiled its call center, which is also directly tied to a wide range of other emergency county services. KTVU's Mark Sayer joining us live from inside that call center. Mark, how are things looking there?
Well, Alex, in a mental health emergency, every second can count, and that is the goal of the people who are working here in this room tonight. From the time their phone rings to the time people are connected to the services they need, they hope that time is about to be vastly reduced. When you dial 988 anywhere in Santa Clara County, you are not reaching a call center in a distant city with people who are unfamiliar with local resources. 24/7, this room is staffed with trained professionals to get you the help you need and fast.
If you're in a crisis, you want to talk to somebody, and you want to talk to somebody now.
Joseph Tansick is with Santa Clara County Behavioral Health, which provides the suicide and crisis prevention staffing to the call center.
The 988 group is going to be not only providing suicide crisis hotline services, but they're also connecting to our mobile crisis response team, or MCRT. They're going to be connecting to our continuum of community response agencies.
Last year, the county's crisis response number received more than 50,000 calls. With the simplicity of 988, the call volume is expected to increase. If somebody calls 988 and is not having a mental health crisis, but is looking for local substance abuse resources, the 988 responder can immediately hand that call off to another expert in the same room. It's hoped the seamless operation between areas of expertise gets the help where it is needed and when it is needed.
988, the national standard is 6 rings or 30 seconds.
There are 10 full-time employees and 75 trained volunteers who will help staff the 988 system.
Sí, está bien.
Call takers speak multiple languages and can tie into a translation system for others. Also housed here is what is called a navigation center to help callers locate and connect with the full range of county services.
That's a county initiative to again provide the community, the whole community, information around community resources or problems they're having getting community resources.
Back to a live picture now. Now, in some cases, calls from this room can be directly transferred to county clinics where people can make appointments to actually get the kind of screening that they need. And while the actual system is now fully operational, not everybody is working here in this same room at this same time. They expect to have everybody in one place in about 2 weeks. Reporting live in San Jose, I'm Mark Sayer, KTVU, Fox 2 News.
Really appreciate the look inside there, Mark. You talked about the call volume and the expectations that obviously it's going to increase as more people learn about this hotline. Are they prepared there in terms of staffing levels to be able to handle more calls as they start to come in?
Well, the predictions on that are kind of difficult, Alex, because now that it's so much easier to remember just 988 instead of 1-800 something, they do expect more calls. They don't know how many, but they feel that they have a very well-trained staff here. They have 75 well-trained volunteers, and they say that they're ready for whatever this new system brings them. Of course, nationally, it just was rolled out a couple of weeks ago, so it's all brand new for everyone. We'll keep an eye on it and see how it goes.
Yeah, we certainly will. All right, Mark Sayer, live for us in the South Bay. Mark, thank you.